Thanks everyone for coming. I'd like to welcome you to our 2023 Medicare Open Enrollment Community Forum. Our presenter today is Bill Drenik, the owner of Washington Senior Resources, and he is an expert, and I'm saying that, not Bill. He's an expert on all things Medicare. He's been presenting here at the Mustard Seed for several years now. He's helped many of our clients. He's helped me personally quite a bit. And I'm really thrilled that Bill will be here to unravel the mysteries of Medicare for us.
You really think I'm going to be able to do that?
Yes.
Okay, I'm proud. It's a confusing industry. And as I was mentioning earlier, everybody's a little bit different. Everybody has a different situation. And so it's really important that I would ask a lot of questions of people. I don't need to answer all of them. I don't, I can't require you to give me the list of your medications. But in order to do research to determine what plan best fits your needs, it's a good thing that I have. Otherwise, you can run into some problems. So let's go ahead and start. As you can see, I'm a former high school teacher. Retired 18 years ago when we moved up here from California. And I mentioned earlier, don't hold that against me because I'm from California. After 18 years, I've been cleansed. Everything is good now. I'm a Washingtonian. But I moved up here and after 4 years, got tired of retirement. I had to do something. And I fell into this business, this crazy Medicare business, really. So confusing, but I love it. Because I can educate. I don't like to sell things. I'm not going to tell you what plan you're on. I'm going to educate you on what plan options you have, answer all questions, go through the benefits, and then you're going to decide yourself because I want you to be confident in the plan that you have moving forward. So that being said, I am local. I live over on Fox Island. So my territory is this side of the bridge. Although I have clients all over the state from referrals and whatnot, but this is my concentration here. So I'm, like I said, local, licensed, and unbiased. I like to educate and make sure that people understand what options they have and you make that decision yourself. My services don't stop when I enroll somebody. I make myself available year round. You have a problem with your plan, you have a question about your benefits, I want my clients to call me first before they call customer service. And I might be able to resolve a billing issue for you. You may get a bill, perhaps, that so what's this? Why do I have a bill for this? My cost is right here in my book. Well, what happens a lot of times is when you're at a physician's office and they go to bill the insurance company, they have a book about this thick of codes. And if they put the wrong code number in there, it's going to come back to the provider saying, we don't cover this service. Well, what happens? You get a letter from your provider saying you owe this amount. Well, in all fairness, it was their mistake to begin with. It does happen. It's a confusing industry, so they might have just coded it incorrectly. Of course, there's no cost for my services. I am compensated by whatever insurance company my client enrolls into. So let's talk about enrollment periods. So this one right here called the initial enrollment is 3 months before your 65th birthday, the month of your birthday, and 3 months after is when you can enroll into Medicare. Now, there's one caveat to that. If your birthday is on the 1st of the month, let's say it's March 1st, your Medicare starts February 1st. Don't ask me why. Neil, maybe you can, nobody knows. Somebody wanted to justify their work date, I guess, and come up with this rule. Don't know, doesn't make any sense. But if your birthday is the 1st of the month, your Medicare is going to start the previous month. So, if you do not enroll during this period, and we will find out a little bit later in this presentation that you will be imposed a penalty once you enroll into Medicare. So keep that in mind. Unless you're on other employer coverage, maybe a spouse, and you don't need to enroll in Part B at that point. You can wait until your spouse retires, and then that's when the two of you will enroll with Part B. Annual enrollment, that's what we're coming up here in a couple of days. This is a busy time of year for us agents who offer to do plan reviews for our clients, and I do that every year. Neil, did you get your letter? I hope. Should have gotten a letter in the mail. Maureen, did you get yours? Yes. It's a request, it's a questionnaire that send me your doctors, your medications. Are you happy with your plan? I have to send you one if you didn't get one.
No, I did not get.
Oh, okay. And what it does is you mail it into me or scan it and send it back to me. And then I do research to find out if your plan is still going to be the right plan for you for next year. Why is that important? It's because with Medicare plans, they have prescription drug coverage and Medicare Advantage plans do, or you have a standalone that has prescriptions. It's possible from one year to the next that a medication or medications are covered this year and your plan may not be covered next year. Well, that's a big problem. You need to know that so we can see if there's another plan that covers all your medications and doctors and reward, which is well important. So that's why I offer reviews, and I keep pretty busy this time of year. Obviously, going through reports. What happens is my client will send me the questionnaire. I'll do my research. I have a report that I'll send to my client saying, here is your situation with the cost of your medications. Doctor, if you're happy with the plan, your meds are still covered, your doctors are still contracted with their plan, you just roll right into next year. You don't need to do anything. However, if a doctor now is not contracted with your plan anymore, or you have a medication that's not covered, or your medication is still covered but at a higher cost, you need to know that. You don't want to go to the pharmacy in January and find out that your medications are much more expensive than they were the year before. We need to know that ahead of time. So if you wish to make a plan change, we can do that. If you have any questions as we're going along here, just ask. Open enrollment. This is fairly new for the last couple of years, right? 2-3 years now. Prior to open enrollment, all you had was annual enrollment. Well, what would happen now? We're in annual enrollment. You don't have your medications checked. You don't check to see if your doctor's a contractor with your plan. You go to the pharmacy in January, and now you have an insulin that was costing you $45 this year. It's going to cost you $400 next year. And you're going to go, well, wait a second. I paid $45 for this. Well, it's no longer in your plan. Pharmacy will tell you this. It's no longer in your plan. It's not covered. So the problem is obvious. Either you have to pay that $400 a month for your insulin, or you don't take it because it's too expensive. And that happens to a lot of people. It's very sad when that happens. So this is where people find out in January that my expensive medication is not covered. Okay, I've got 3 months to one more chance to make a plan change. So you find out January the 5th. You go to the pharmacy and your medication is not covered any longer. You can make a plan change in January. Your new plan will start February 1st. And if you find out in February, you want to make a plan change, it'll start March 1st. You find out in March, it'll be April 1st. So you do have that window of opportunity to make a change. It was wonderful they did this because it saved people a lot of issues, obviously cost, and we want people taking their medications.
Can I ask a question?
Yes.
In here you say for the Medicare, I'm assuming you're talking about both of these. Sometimes there's a 90-day waiting period. Does that happen during these enrollment periods if you're just trying to change your medication?
90-day waiting period for what?
You may have a waiting period of up to 90 days for any pre-existing condition to be covered after the plan starts.
That is in certain situations that every state is a little bit different. There, with the state of Washington, they do allow you to make a plan change without any health questions during annual enrollment. Yes, if you are, when you first become Medicare eligible, either at age 65 or when you're coming off employer coverage, you have the ability to enroll into a supplement plan without any health questions. However, if you, once you pass that period, then they say, yeah, you can apply, but we can deny you. Because what happens is Medicare Advantage plans have what we call a maximum out-of-pocket cost. It's the maximum that you're responsible for medical services throughout the year. Usually it's $6,000 to $6,500, somewhere in there. Every plan is a little bit different. Only about less than 2% of people actually hit their maximum out of pocket. Because with a hospitalization, it's the one service that people say that, what if I'm in the hospital for 30 days? What's that going to cost me? Well, in all these plans, hospitalization is going to be covered at around, the general figures here, around $400 a day or night. And you're responsible for, let's say, 5 nights. So if you're in a car accident and you're in the hospital for 30 days, your hospital bill is going to be $2,000. Yeah, and that goes towards your maximum out of pocket. I have some clients that go to the hospital 3 to 4 times a year for 5 days or more. It's $2,000 every time. Well, they hit their maximum out of pocket. So it would be cost effective for them to be on a supplement plan because dollar-wise, it's much less than that. So supplement plan companies know that the only people who are going to be moving from Medicare Advantage plan to a supplement plan most likely is because they have very high medical costs. So there is a little bit of a waiting period there on some of them. And this is where it gets, you can see, very complicated. So every individual person that I enroll, these are the questions I'll be asking to find out what works best for you right now. Is it a Medicare Advantage plan? Is it a supplement plan? And if you have some real health issues at this stage, we're really going to take a look at a supplement plan moving forward. Because I've had clients this past year, as a matter of fact, the economy's getting a little tighter for people. And they have some medical bills and they want to go to a supplement plan. Yes, you can go ahead and apply, but you may not get approved. Okay, so hope that answers your question.
Thank you.
Special enrollment period. This is for people who continue to work past age 65 and they have employer coverage. And let's say at 67, they say, time to retire. Okay, well, you got, and I'm going to do it in June, middle of the year. Can I get coverage? What about annual enrollment? Does that apply to me? No, it does not. People retire in the middle of the year. So if you retire in June, then you can apply for Medicare Part B. 3 months before that, you should, because it takes about 4 to 6 weeks for your Medicare Part B to be approved. And then you can, we set it up so we apply and get your application submitted so you have coverage either June 1st or July 1st or whatever it is, once your employer coverage is going to end.
Bill, what is the time period? What is the enrollment period for special?
There is none.
There is none.
Anytime during the year.
So, no, well, let's say, as you mentioned, your employer insurance stops in June. And of course, then you go on full Medicare. Do you have a time period to make that change?
That's 8 months.
No, that is 8 months.
Yeah, it's 8 months after that. I don't know why anybody wouldn't want to wait though.
Yeah.
You know, you're retiring and you want to have Part B coverage. That's all medical services, right? So you don't have to, but if you don't enroll within 8 months, then you are subject to a penalty once you do. Great question.
Because I've been asked that question.
Yeah.
Did not have the answer.
Yeah, good. Now, what if you're moving out of the service area? You're in Kitsap County or Pierce County. You're moving, let's say you're coming from Kitsap to Pierce Pierce has more plans, Medicare Advantage plans than Kitsap does. So you're moving out of your service area, or you're going to Idaho, or you're going to wherever, you're moving out of state. You have the ability to enroll into a Medicare plan at your new location. And you'll want to do that ahead of time before you move, if at all possible, so there isn't any gap in coverage. The other special enrollment period is for what we call dual special needs plans. Those are people who are on Medicare and Medicaid, the DSHS. If people are on Medicare and Medicaid, I need to know that because there are other plans available also, other than what we call your standard Medicare Advantage plans. So you would be eligible if you became, let's say you just came onto a Medicare savings program for the DSHS, then we can get you onto a dual special needs plan. These are all private conversations that I have with my clients to ask what your situation is so we can determine which way to go. So who's eligible for Medicare? Well, Part A, most people don't pay a premium for Part A coverage. So what does that mean? Well, if you work 40 quarters, that's 10 years, and you paid into Social Security and Medicare, you automatically are enrolled into Part A at no cost, no monthly premium. Okay. And Part A is hospitalization, skilled nursing, and hospice care. That falls under Part A. So when you turn 65, you're automatically entitled to Part A. You qualify or are already getting retirement and disability benefits from Social Security or the Railroad Retirement Board, you become eligible. You've been on SSDI, Social Security Disability Income, for 24 months. I have a lot of my clients that are under 65. I'm working with right now who's 38 years old. She's been on disability for 2 years, and now she becomes eligible for Medicare. That's the one good thing, that we really take care of those people that really need the help. And that's why I really love this industry. You're 65 or older, and you or another qualifying person, like your current or former spouse, pays Medicare taxes while working for at least 10 years. So you don't need to necessarily have to be paying into it, but your spouse does. If your spouse does, because a lot of people are homemakers. They take care of the kids. They never really had an income. They relied on the spouse. That happened. It used to happen an awful lot. Not as much these days, but still does. Then you would not. You wouldn't have to worry about a penalty because your spouse has actually worked for those 40 quarters. Yes.
Hospice is covered by Part A. Does that include any medications that hospice would? That's a separate.
Yeah. Now, I should say that if you're in the hospital and you're administered medications, then yes.
Okay.
Yes, it is. But it isn't a separate policy for medications. Yeah, anything through the hospital would fall under Part A. And Part D, which we'll get into a little bit later, is medications you get from the pharmacy or mail.
Okay.
Yes, sir.
On the Part A coverage you talk about, and the training, not nursing, that's different, but
No,
say it's an hospitalization office, one other thing.
skilled nursing facility.
So that's like a rehab, one of those
It's a rehab
and
center.
then it's a maximum of 30 days.
20 days.
20,
It's 20 days and no cost.
okay.
And then after that, there is. Now, a skilled nursing facility, I had experience with this with my mom.
Yeah.
She broke her hip. She was about 85, broke her hip. She was in there for 8 days. Okay, you have to be progressing when you're in a rehab center. If you're not progressing, you're regressing, they're going to put you back in the hospital.
Yeah.
But they know that 20 days you're going to start paying. So most people are actually move out of the skilled nursing facility at that point because people know they're going to have costs. The other thing I wanted to say about that is, then later on, she broke her pelvis about 5 years later. She was in for 11 days. So, not too many people will be in a skilled nursing facility more than 20 days.
But in theory, you can keep going
You
back.
can keep going. There is a cost to that. It's maybe, depends on the plan, $150 a day. Great question. So if you don't qualify for part A, you have a premium. And that's calculated by Medicare. Part B, you'll pay a premium for Part B in most cases, unless you're receiving extra help, we call it, and we'll get into that also through Social Security based on your income. So even if you don't get any Part B covered services, you should need to enroll in Part B. So you are, so that you do actually have access to that. There is a premium for that. And that goes together. In order to enroll into a Medicare Advantage plan, you need to have Part A and Part B. In Part B, there is a monthly premium. This year it's $164.90. It actually went down from $170. It went down, but from what I hear, it might be going up again next year. So it's going to be somewhere around in that area. And monthly premium can change from year to year, as I mentioned, and it could depend on your income. I'm working with a client right now who his Part B premium is going to be around $400 and some odd a month. Why? Because of his income 2 years back. They go 2 years back on your tax returns. So in that situation, but he's retired. So his income is going to be going down. So there is an opportunity for people to, in that situation, to submit what we call an SSA 44 application to Social Security, which they will, it's a life-changing event. Your income is going down dramatically, so they can adjust your Part B premium and bring it down.
Question.
Yes.
Just out of curiosity, first off, Part B premium is the doctor's office visits.
Yeah, Part B, good question. You got your doctors,
Yeah.
labs, outpatient surgery, radiology services, physical therapy, all of those fall under Part B. All medical services, hospital, everything other than hospital basically falls under Part B.
Second question, 2 years back. So we're talking, I just want to make sure I'm counting right here. So they're counting 2 years. So if you turn 65, they're going to take 60 the years that you were 63 and 64, and they take because your birthday is not going to fall on January 1st or December 31st, likely, at least it's not likely. They're going to take those full years, even though you're only partially going back 2 years or 2
They'll go back to your tax returns.
Oh, so it's 2 cash. Okay.
Yeah. Yeah. And what will happen in that situation is, if you're not, let's say it's continuing to work. I have a lot of attorneys.
Right.
They continue to work past 65. They have coverage through the firm. And so they don't need to enroll in Part B. But when they retire, that's when they look back and say, okay, you made $400,000 2 years ago. Now your Part B is going to be higher than the standard for that year. That's when I tell them, fill out an SSA 44, send it in, and see what they can do for helping you to reduce that.
I think the cutoff income is something like
Well,
$95,000 for.
individual, yeah, and about 190,000 for a couple. Now, you could have sold a piece of property 2 years ago too. That counts.
Yeah.
Okay, so it's kind of important to know that there are ways that you can at least submit information to see if that can be adjusted.
One last question on Part B, we both have elderly parents and they both complain about this subject. Has it always been income index?
For Part B?
Yeah.
I don't know how you
Is
say it.
is that a fairly new thing?
No, it's been around for, yeah, if you're making more money, that they want to do more.
Yeah, yeah.
It's just the way it works.
Yeah, no, it's,
Yeah.
no, it's the first time our parents are complaining about it.
Yeah.
And they usually don't shot a lot.
As we get older, we
Yes.
use that shyness. So, so, most people don't get a bill from Medicare because they're get the premium deducted automatically from their Social Security. Well, nowadays, a lot of people aren't getting their Social Security until later, right? So you enroll into a Medicare plan, or let's say Part A and Part B only, and you aren't receiving Social Security benefits. They're going to bill you 3 to 4 months in advance. And you might get a bill for $500. You may say, "Whoa, what's this all about?" Well, you're not receiving. They're not going to bill you monthly. They want to bill you quarterly or whatever it is. One of my clients said it was 4 months. I don't know if it's out that far or not, but I want to cut down the administrative costs, I guess, not having to keep sending information out. So they bill you ahead of time. But if you're receiving Social Security benefits, they deduct that Part B premium directly from your monthly payment. Okay, so this is what your card looks like. How do I sign up? 3 months before your 65th birthday month. And you can enroll 2 different ways. Most people, I say, go to ssa.gov and apply online. That way you've got an account. You don't need to go into the office. You don't need to do it over the phone appointment. It's much easier. Then you've got an account. So when you're ready to receive Social Security benefits, you go right into that account and apply for it. So it's a good way to go. However, you can go down to the local Social Security office and apply yourself at that point as well. Some people want to do that. They might have other questions to ask.
If you're a naturalized citizen, you have to go into the office.
That makes sense.
Because you have to prove that you are a
Yes.
citizen or you are a legal resident of the United States.
Good
No.
point.
No,
No?
no, I'm a naturalized citizen and I did it on SSA.gov.
Oh, yeah.
Yeah.
Okay.
I had no choice. But it could have changed.
Yeah. Yeah.
Because I had to go into the office.
Oh, okay.
I think it must have changed.
Okay, it might happen. Yeah, I was unaware of that.
Yeah, I was here.
Okay. So here's the 4 parts of Medicare. So you got your Part A, hospitalization, skilled nursing, hospice, home health care. Part B is all other services, and that includes durable medical equipment, wheelchairs, oxygen, those types of things are also fall under Part B. Normally, you're going to pay 20% of the cost of those products. Some preventive services, and on all the Medicare plans, Medicare Advantage plans, they have preventive services. And that is mammograms, pap smear, colorectal screenings, prostate exams, bone mass measurement, on and on and on, no cost. And plans pay for it. Yes, ma'am.
How about foot care? Thinking about my parents, I thought it was covered for something that they were doing and where they live, and then they wound up having to pay for it, like,
They're probably more of a specialist visit, I would think,
so podiatrist, like.
podiatrist.
Yeah, like special, so that would have not been covered. unless-
Yeah, that, but they should pay me $35, $45.
I'm not ever paying over 100.
So they're probably going out of their network. You have to, depends on the type of plan.
So,
They have networks and the HMOs have a network you have to stay within. That might have been what
I
happened.
bet it was,
Also, what can happen, happened to me is, I had got a bill from the anesthesiologist. And so I appealed,
Yeah,
so, but
there you go. And yeah, so when you're in the hospital, I'm glad you brought that up, Bill. When you're in a hospital and you're having surgery. And your bill, and you're responsible is 400 a night, let's say. What's included in that 400? Operations, anesthesiologist, room and board, nursing care, any medications that are administered to you while you're in the hospital, that all will fall under Part A. Once we get to Part D here, prescription drugs, those are the ones you get from the pharmacy or mail order. A little bit different there. So yeah, I can see where you should not have been charged for the anesthesiologist. Okay, so Part D prescription, we'll bypass Part C for now. Part D is, I said, medications. You can have a Medicare Advantage plan. As you said, you got two different types of plans. And if you're on a Medicare Advantage plan, there are prescription drugs embedded into the plan. Okay, so you have prescription drug coverage.
Most of them.
Well, most of them do. There are a few that, and I was going to get to that. There are some that do not have prescription drug coverage, and who are those for? Veterans. If you haven't receiving VA benefits and you are receiving your prescriptions through the VA, there are only a class of individual who can actually have two prescription drug plans at one time. But they can also enroll into a plan that doesn't have prescription drug coverage because they have it through the VA. Why would they want to do that? Well, if you don't have prescription drug coverage in your plan, then what happens is that company isn't paying for medications. So your dental might go up, your hearing benefit might go up, your other services that you get might be eyewear, things like that. There are certain benefits that the VA doesn't offer. So it's a perfect plan for veterans. God bless them. If anybody here is a veteran, God bless you. Thank you for your service. If you're on a supplement plan, supplement plans do not include prescription drug coverage. So you would have to apply for a standalone prescription drug plan. So you've got your supplement plan, you have a standalone prescription drug plan. There are right now 24 prescription drug plans, standalone prescription drug plans in the state of Washington. So there's a lot from which to choose. I had a person call me, well, it's been 5 years now, so, and he said, my buddy said to give you a call. He said, you're his agent and he's on a Medicare plan. I said, okay, how can I help you? And he says, well, he goes, I'm on Medicare and I just got prescribed a medication for my daughter, cholesterol pill. And I said, okay, well, how old are you? He said, 72. And I said, well, what Medicare plan are you on? He goes, well, my red, white, and blue card. I said, you don't have prescription drug coverage? He goes, no. He goes, why do I need prescription drug coverage? I don't take medications, or I didn't until now, need to. And I said, well, the problem with that is now you're going to incur a penalty for not having prescription drug coverage. He goes, what are you talking about? And I said, well, it's just the rules. And he goes, well, how much is that? And I said, well, based on 7 years, and back then I said probably between $25 and $35 a month is what your penalty is going to be for every month for the rest of your life. And he's unbelievable. I can't believe it. I said, well, and I said, best thing is to call Medicare and they'll calculate that for you. So he came back to me a couple of days later and said, that my penalty is going to be $27.50 a month. So what do I do? And I said, okay, well, here's your options. You don't need to do anything if you don't want to. You can buy your cholesterol medication down at the pharmacy for probably $10 a month. You have no penalty because you haven't enrolled in a prescription drug plan yet. However, if you enroll in a prescription drug plan, now you've got this penalty every month. And he said, what do I do? And I said, well, I don't tell people what to do, but let me advise you of a potential issue. 2 years from now, you go to your doctor and it says, doctor says, hey, Bob, you got COPD, we need to put you on an inhaler. Could run $300 to $400 a month. Well, if you have a Medicare Advantage plan or a prescription drug plan, that could be $45 a month. So he said, yeah, I think I'll just go ahead, enroll into a Medicare Advantage plan, but pay for my cholesterol medication. And then I'll just pay the penalty every month and go on from there. So that's what he did. So now at least he has coverage. He's paying that penalty. He never knew about it. No, he got a letter in the mail, probably. Maybe he did not when he was 65, advising that you need to have prescription drug coverage of some sort. or else you can incur a penalty. So let's move to Part C. Part C is Part A, hospitalization, Part B, medical, and prescription drug plans all in one. As Neil said, some of the plans don't have prescription drug coverage. Because it can include Medicare Part D, doesn't need to. There are plans that don't have Part D in it. And I've had people say, I don't want prescription drug coverage because I'm never going to take a medication, no matter what they tell me. Okay, that's your choice. They don't believe in medications. And for whatever reason, that's their choice. I think it's a roll of the dice to think that way, but people have the right to choose the way they want, and I'm okay with that, just as long as they're aware of the potential consequences. And all of these plans are run by private insurance companies. So some of these Medicare Advantage plans, and we'll get into it here in a little bit, have a 0 monthly premium. How is that possible? How can you get onto a Medicare Advantage plan? You're already paying for your Part B premium, right? Now, you can go a Medicare Advantage plan that has a 0 monthly premium, or it has premiums or other premiums. You can have a plan without a premium or with premium. They cover all the benefits, your major benefits, your doctor visits, your x-rays, your radiology, your outpatient surgery, all that is covered on all the plans. You have a premium plan, the copays usually be a little bit less. So that's what we determine when we're figuring out what type of plan you want to enroll into. The other thing I was going to say, skip my mind here for a second. Well, let's move on. I'll come back with yes.
One reason that many of the advantage plans do not have to, because you have co-pays. So when you see your primary care physician, nowadays it's usually $5. It used to be more. When you see a specialist, then $40, $50. So that's how I think how they make it up for the.
Well, actually, what they do is thanks for bringing us back to where I was before. The reason they can offer 0 monthly premium plans is because Medicare says to insurance company X, okay, you're going to enroll Joe into one of your plans. This is what we're going to do. We're going to pay you so much a month based on his health history to take on, and then you take on the responsibility of any additional cost. I'm just going to throw a number out there because I have no idea what it might be. Let's say it's $1,000 a month. Medicare is paying the insurance company $1,000 a month. The insurance company is saying, well, we would like to keep this person healthy, keep him out of the hospital, keep him out of services, because if he goes to the hospital for one night and he pays $400, we got to pay the balance. Who knows what that amount could be, right? Now, especially when you have an operation. So what happens is Medicare says, now we're no longer responsible for the costs of that service. You insurance companies are responsible for that. That's where we go back here to where these preventive services, no cost. That's why the insurance companies pay for those services for you, because if something's going on, they want to catch it early.
And you do not have those funding Medicare plans, the preventive service.
Well, preventive services, you can go on there. Yes, if you have a deductible. We can go into the weeds a little bit here with this, but you can with the supplement plan also. You can. So that is that gives people the opportunity then to be able to use these free services to determine if there's anything going on, and the insurance company wants to know that. So usually if you're on standard, the red, white, and blue card we saw earlier, and you're just on that, this gentleman that didn't have prescription drug coverage, remember him? He is A and B. Well, he has coverage, but now he's got a deductible for Part A, and he's got a deductible for Part B, and he's going to be paying 20% of those services for Part B. The Medicare would pick up 80%, client picks up, or the Medicare beneficiary picks up 20%. So when the insurance company says, okay, the Medicare Advantage plan, we're gonna go ahead and pay you X dollar, the insurance company so much per month, take on that responsibility, the Medicare out of it, they don't have to pay that amount. So they figure, you insurance, you guys can handle this better than ourselves, we're gonna pay you so much. And at that point, the insurance company takes over. Okay, so who can tell me the difference between a co-payment and a co-insurance? Co-payment is a predictable cost. You go see your primary care doctor on your plan, and it costs you $5. That's a co-payment. Co-insurance is a percentage, and with Medicare, it's 20%. So as I mentioned earlier, with durable medical equipment, you're going to pay 20% of that. It used to be, not too long ago, that a lot of radiology, outpatient surgery were co-insurance, that's 20%, but you didn't know what that 20% was until you got billed. Didn't necessarily mean it's going to be more expensive than a co-payment, but insurance companies now are going more to co-payments. So if you're going to go in for outpatient surgery to replace a knee, let's say, you'll know ahead of time exactly what that's going to cost you. So these plans are evolving every year. They're getting better, more transparent, if I will, and that's always a good thing. So that's co-payment, co-insurance. Deductible, that's the amount you pay before the insurance starts. A Medicare Advantage plan don't have a deductible for medical services. However, I have to say that there is one plan out there that does, but typically speaking, you do not have a deductible to meet before your co-payment. You go to your doctor, you pay $5. You have no deductible. You're hospitalized for a night, no deductible. You pay $400. So the plans right now, they're changing a little bit. So there's one company that is allowing a deductible. However, if you're going to have a deductible, some of your other benefits are going to be higher. You'll get more benefit for certain services because of that, because you are subject to the deductible. You may never use the deductible, but you're kind of, if I go to the hospital, okay, I'm going to have a deductible, let's say $1,000. Don't know what that might be. But if I don't go to the hospital, I don't have the deductible, and maybe I have more dental on my plan because of that. That makes sense. Okay. So what's Medicare Advantage? Well, it's Part A, Part B, Part D, and a lot of extra benefits. All these plans offer no-cost health club membership. Now, not to every health club. Some of them have the YMCA. Some of them have Anytime Fitness. There's different networks. And if I have clients of mine that are very healthy, they go to the doctor once a year, low medications, what's important to you? My wife and I go to the YMCA, we'd love to have that membership paid for. Okay, we can do that. We'll find you a plan that actually covers that benefit for you. So this is where we get into, and that, to me, the free health club membership isn't that important to me. To me, it is just make sure your meds are covered and your doctors are covered. I'm contracted with 55 plans. So when I do a research for somebody, okay, here's a list of your medications. Okay, now that gets shrunk down to, let's say, 25 plans that cover all your medications. Okay, now let's take a look at your doctors. And of that 25 plans, which plans are covered by all your doctors? And it shrinks it a little bit more. Now we've got this basic good plan for you. Now what's important for you? I started asking, is it dental? Is it hearing? Is it vision? Is it a health club membership somewhere? And then we can take a look at that, see if we can fit that for you as well. So there are a lot of benefits. I wear hearing aids now, wonderful benefits on these plans. You know, I have a lot of people that they turn 65 and they say, I can't believe how wonderful it is to turn 65. Because compared to what insurance I have right now, he said, I really like these plans. Okay. So here's different types of Then we briefly spoke about health maintenance organizations, HMOs. That is a network of physicians that you can see in your plan. Fortunately, we live in a area that has large networks of doctors. Some of these plans are contracted with Franciscan and multi-care. Some with just multi-care, some with just Franciscan. But there's, some of these plans have over 20,000 physicians in the network. So it's not a bad idea to be an HMO if that works for you, because all your doctors are in that network already. And if you need a specialist, we can find one for you, certainly within that network. You're required to have a primary care physician, and you may need a referral. A lot of people say, I don't have to get a referral from my doctor. These plans now are developing to where a lot of them do not require a referral. If that's important to you, you need to know that. However, your plan may say you don't need a referral, you go to see a specialist. And the specialist say, well, I need a referral. You go back to the primary care physician and say, no, I need a referral. So they would have to process that. But in many cases, you do not need a referral in some of these plans. Let's jump over to PPO. PPO is similar to an HMO. It has a network of physicians, but it does allow you to go outside the network if you want to, assuming that that specialist will accept that plan. Okay, so it gives you a lot more flexibility. HMO POS, this is where you can go outside the network for certain services. Let's say for dental. A lot of these plans now, they have dental. You have a network of dentists. But if your dentist is in there, it'd be good to know who your dentist is, so we can find out in the network. If that dentist is out of network, you can still see that dentist, but you're going to have to pay ahead of time and get reimbursed from the company. And you may have what they call balance billing, which means that you may pay part of that benefit. So if you go in for an exam, oral exam, a cleaning, and an x-ray, and let's say that costs $350. And your doctor is in the network, they bill the company directly. You don't do anything. However, if he's out of network, you have to pay the bill, fill out a reimbursement form, send it in, and you'll get a major portion of that paid back to you. So it's important also when I say I want to know who your physicians are, I want to know who your dentist is also, to see if he is in network or not. If he isn't in network, that's okay, you can still see, but you'll be paying part of that bill. Okay, moving on. Formulary is a list of drugs in your plan. Every plan has a different list of medications they cover. Now, Medicare requires these plans, if you're going to offer prescription drugs, you have to have a certain number of medications for each category of need. Insulins, for an example. There are a lot of insulins. Plans don't cover all of them. They cover some of them. So that would be important to know, is to make sure that your insulin is covered on your plan. Yeah, I take an insulin. Well, what is the type of insulin? What's the brand name and what's your dosage? Let's make sure it's covered. Very, very important. Now, as I mentioned before, you have a drug formulary. This can change every year on your plan. They can take medications off. I'll give you an example. I had a client that was on cancer medication called Revlimid, tier 5 medication, very expensive. He was paying $6,000 a month before he got onto Medicare. I was able to get him on a plan that covered it. There was only one plan in Pierce County that covered it. And his doctors, if this happened to work, if his doctors are contracted, the plan was perfect. Got him on there. And I think the cost went down to $1,200 a month. Still a lot of money, but a lot less than $6,000. Every year, I told my client, now this was before open enrollment where you have a second chance to make a plan change from January 1 to March 31st. This is a few years back. This is before Medicare allowed that open enrollment period. End of November, I have on my spreadsheet, I highlight my clients that have very expensive medications. And every year, back then, I would tell them, I would just automatically take a look, wait for them to send me in their information so I can do a plan review. And this one gentleman did not, it was end of November, we have 1 week left. End of annual enrollment till December 7th. And like I said, open enrollment from January to March was not available back then. So I ran a report for him and saw, my God, his Revlimid is not going to be covered on his plan for next year. I didn't hear from him. I called him up and I said, Lee, how you doing? I'm doing good, Bill. What's up? Because well, I'm going to be in your neck of the woods. I'm going to just drop by and see how you're doing. Everything okay? I said, everything's fine. Well, I knew at that point that there was another plan that was coming in that year that was going to cover his medication and his doctors. Thank God. So I got to his house and I said, I got some good news and I got some not so good news. I said, let me give you the good news first. I don't want you to have a heart attack. Your doctors and your medications will be covered for next year. The not so good news is you didn't contact me and you didn't give me your medications and ask me to do a plan review for you. It's not my responsibility to do that. It's yours. And he said, oh my God, I remember getting your letter, but yeah, I did, I got a lot going on. I understand that. But that would have been catastrophic for him. Now, the one thing we did do when he first turned 65 is I said, God, you get $1,200 a month, still a lot. I said, did you contact the pharmaceutical company who makes that Revlimid medication? He goes, no. I said, contact them, find out if they have a grant. He contacted, he got a grant. 6 months, no cost. So then again, anybody has expensive medications, always see if there was a grant from the pharmaceutical company. Call them up and ask.
Excuse me,
Yes,
I've seen some of those pharmaceuticals question that they will not give you the discounted price because if you're on Medicare. I read it first.
that could be on some, that might be their policy.
Yeah,
He was on Medicare and he was able to get the grant.
I just noticed if I'm not on Medicare, but I noticed it's changing.
Oh, okay, so that's good to know, yeah. But it's always, it doesn't hurt to apply, right?
No,
And ask, find out. Might be surprised, pleasantly surprised. Cheers. So we've got several tiers of medications, 1, 2, 3, 4, 5. And now we have a tier 6 medication for a specific list of meds. Tier 1s are generics. Tier 2 are preferred generic. Preferred generics are 1, generics are 2, preferred brand name are 3, and regular brand name are they go from 1 to 5 in cost. The tier 1s are, your cholesterol, high blood pressure, those types of medications. And many of those are at no cost on your plan. But that's where we determine. The thing is that, and I have found this out when I've done reports for my clients, is that I will find out on one plan, their medication is a tier 2, which costs them $12 a month. But on another plan from a different company, it's a tier 4. Which is around $100 a month. It just depends on the plan on what they cost for their medications. They're all different. And to me, this is the most important part of a Medicare plan is knowing what the cost of your medications are going to be. And many times I will tell clients also, because it's good to have conversation and ask questions and pull information from my clients because it's hard to do sometimes. But then I said, well, a doctor said that I might have, he might want to prescribe me a different medication. I said, well, find out what that medication is and let me know. Let's make sure it's on your plan just in case. Because the doctor says, your oncologist said you need this cancer med, but it's not covered on your plan. It's the middle of the year. What do? You have no recourse. So let's make sure that it is covered. If you have that conversation with your physician, let me know what that medication is. Network of pharmacies. There are standard pharmacies, there are preferred pharmacies, there's mail order pharmacies, there's all kinds of different types of pharmacies. And depending on the type of pharmacy it is, will depend on the cost as well. So we take a look at that. Obviously, you want to go to a preferred pharmacy because that pharmacy has a contract with your plan and they have an agreement on cost, Medicare, medication costs. So that's important to know also, is that will determine, but when I do a report, I always make sure I'll show people. A lot of people love cost less here locally. They're wonderful people. People just say, I don't care, I want to go to cost less because I just like the way they do business. Okay, well, I'll show you that, but also I'm going to show you mail order just in case you want to, show you what your options are. Transition process. Okay, we talked about that medication in the middle of the year that isn't covered on your plan. The plan will give you it's a transition of about 30 days to be able to pay for that medication for you. But after that, you're on your own. So there is a little bit of help there. Prior authorizations, well, we all know about opioids and things of that nature. You have to, in many cases, require authorization for expensive medications. Your doctor just has to submit medical records indicating that you need to have that medication. Quantity limits, that also is for opioids, maybe 30-day maximum on some medications. Can't get a 90-day supply on those. So that's called quantity limits. Step therapy. This is where your doctor prescribes you a tier 2 medication. And your plan says, you know what? We have a tier 1 medication in that same category that might work for you. You want to, we'll try it. If it works, great. You save money, the plan saves money. If it doesn't work, then you step back up to tier 2 medication and you get the original medication your doctor prescribed. Okay. The gap, also known as the donut hole. Very complicated, but bear with me on this. So the donut hole or the gap, not to confuse that with Medicare and supplement plans, two different things, right? The gap is the donut hole. That's going away in 2025, by the way. So this won't even have to worry about this. But on all plans for this year, there's a $505 deductible that plans can charge you for your medications. They don't have to. Some plans have a $0 deductible on maybe tiers 1 and 2, but you have a deductible for 3, 4, and 5. Doesn't have to be $505, could be $100. That's up to the plan, but you would have that deductible first to meet before your plan costs kick in. Okay, now you're in phase 2, initial coverage. You're going to pay about 25% of the cost of the negotiated price that your plan has with the pharmaceutical companies. Medication costs $100. You're going to be paying $25. Plan's going to be paying $75. Okay. Now, once the total amount of your medications, what you pay and what the plan pays, once that reaches $4,600, then you fall into the donut hole or the gap. Now, before I go further, you'll get an explanation of benefits every month that'll show you what you paid, what the plan paid, and the total cost. And it should tell you, I don't know if maybe you guys help me, tells you how close you are to get into the donut hole.
Yep.
And so that's good to know. So you can kind of plan ahead and understand that you're going to go to a pharmacy in October now, and the cost of your medications have actually gone up. Why didn't that happen? Well, you fell into the donut hole. Okay, so And you know, it could be that you paid $1,000 and the plan paid $3,660. So the total amount of what gets you into the donut hole. So you're here, you're into the donut hole now with the gap. How do you get out of it? Well, now the rules change. When you're in there, you're gonna pay 25% of the retail cost, not the negotiated cost that the plan had with the pharmaceutical company. So your cost, your medications go up normally during when you're in the gap of the donut hole. So how do you get out of the donut hole? Well, the rules are now, they're changing. It's not what you and the plan paid, it's what, once you reach $7,400 out of your pocket, it's when you fall into what we call catastrophic. And that's when the cost of your medication will go down to 5% or a very low copayment. I have some clients that are on MS maintenance, multiple sclerosis medications. They get those medications through the pharmacy. They're self-injectable, and those run around $1,700 a shot. And so a lot of them will fall into catastrophic. They know that I'm going to be paying around $7,400 or more per year for my medications just because of that. So, but once they get into catastrophic, then they're going to pay a very small amount for the medications. So there's help for people in that area. But like I said, in 2025, this is supposed to go away. So we'll see what happens. That's the plan. All right, supplement plans or Medicare plans. Now, a supplement plan, how is a supplement plan different from a Medicare Advantage? Well, Medicare Advantage plan, right, it's got their HMOs or PPOs. You have a network to work with them. Supplement plans allow you to go into any physician in the country who accepts Medicare. You can go to Mayo Clinic if you want, if you need to. So there are no referrals, prior authorizations, those types of things. You just go and you get your work done. Supplement plans are more expensive than Medicare Advantage plans. In many instances, I'll give you an example here. You'll see this G right here. This is the most comprehensive supplement plan that's available. It pays for everything except for your deductible. They don't pay deductibles anymore. On these plans here, they did. If you are, if you turn 65 before January 1st of 2020, you can still get onto one of these plans. They pay for your Part B deductible, but Medicare said, no, I can't do that anymore. So January 2020 on, you have to at least pay the deductible on the plan. So I'll give you an example. Plan G can run from $190 to $230, let's say, per month. And what other cost you have is just your Part B deductible of $226. Once you make that monthly payment, and once you hit your $225 deductible, you have no cost for the rest of the year. So you kind of figure, if you were to go that route, that you're going to have your medical costs, basically premiums and deductible, are going to be around $2,700 a year, whether you use it or not. But it's never, your medical costs will never be more than that. And the one thing about supplement plans is when you become first eligible for Medicare, that's when you turn 65. And when you're coming off an employer plan, you can enroll in these plans without any health questions. If you're on a Medicare Advantage plan, and a couple years down the road, you say, you know, my medical costs are, you know, the maximum out of pocket we talked about, the $6,500. You get up there, you say, wait a second, I can be on a supplement plan for $2,700 a year. I want to go on a supplement plan. Well, they're require you to answer health questions, they can deny you. So if you are interested in a supplement plan, now when you become first eligible is when you want to consider whether you want to enroll in the plan or not. You can always do it later, but you could be denied. And they're going to look at your medications and your health history to do that. Because they know the reason why you're coming off Medicare Advantage plan is because your medical costs are very high. And you'll see there's other plans here also, but there is, and these all have different premiums. They have a wide range of what the premiums are on all these plans. And some of these you have some costs involved, like right here. You'll have co-pays, go to doctor, hospital, those types of things. So those are available as well. But I'd like to talk about Plan G because that's the one that most people will enroll into. They say, look, I don't want to have to worry about paying my doctor bill every time I go. I don't want to have to worry about cost. I know that my medical costs are going to be this much and no more than this much a year, whether I use it or not. And being a teacher, I promise I'm not going to give you a test afterwards in order for you to leave the room. No, so just don't worry about that. It's a little complicated. Okay, late enrollment penalty. We talked about that. Was a gentleman who was 72, didn't have prescription drug coverage. It was prescribed a cholesterol pill, and he had his penalty of $27.50 per month the rest of his life. And you do have a 63-day period. Once you're coming off of some what we call creditable coverage, employer coverage or whatever it might be, you do have a 63-day. If you're moving and to another area, you also have 63 days to be able to make that change.
Yeah, that's not true with Advantage ones, right?
It is for Advantage plans as well. Let's say you're moving from one county to another. I'm with the client right now. She's saying, I'm still having 63. You have 63 days to be able to make your plan change. Yes. So she's moving from Alabama back to Washington, where she was born. And so you have 63 days from the day you came here to be able to make a plan change and avoid any penalties. Extra help. It tells people if your monthly income is around $1,700 a month or less, you should apply for extra help. Even if it's around $2,000 a month. I say apply anyway. All I can say is no, you're not eligible. If you are eligible, then in many senses we may pay for your plan premiums, your deductibles, co-insurance, and during the coverage gap, you have no coverage gap. There's no donor hole. And the cost of your medications are going to be substantially less if you are approved for extra help. And you can do that, as you can see here. I have people that usually go to SSA.gov to do that, but you can call them, you can go through Medicare itself as well. But anybody, and I'm surprised sometimes too, that somebody's a little higher income, but they were approved. That's wonderful. So, something to think about. This is just basic stuff we talked about, why you need to have a plan review every year. As I mentioned right now, I have around over 200 clients of mine that I am in the process of doing plan reviews for. I ask for it and they're coming. I don't do anything for 52 days until December the 7th. We do have Thanksgiving, but usually I will put a couple hours on that day as well. It gets real hectic, but I love it. I'm passionate about this business because I love educating people. I love helping people, and I get a lot of satisfaction out of knowing that my clients are in the best plan for their needs. Only way to do that is to do a plan review every year. Every year, if you're on a Medicare Advantage plan. If you're on a supplement plan, you don't need to have a plan review because your plan, you can go to your doctors, you can go anywhere. However, you're going to have a prescription drug plan on the side, aren't you? That can change. So I tell my clients who are on supplement Medigap plans, send me your list of medications as well. And let's make sure that the plan you're on is still going to be the lowest cost out of the 24 plans. And quite often they will change, where I'll, have somebody, this morning, I was doing a review, and one client is on a Medicare Advantage plan. But there's another Medicare Advantage plan that had covered all her medications and all her doctors, and her medications were half the cost on a new plan for her. So I'm gonna tell her, here's an option. If you want to, we can move you to this other plan for next year. You save money, you can still see your doctors, medications are all covered. And here are your ancillary benefits, dental, vision, hearing, etc. If you want to make that plan change, we can do that for you. If you don't want to, that's fine as well. I just want you to be aware of what your options are. All right. This senior savings program for insulins is a wonderful thing. On some of these plans, they have what they call senior savings program for insulins. And if your insulins are on their formulary, then you're going to pay $35 for your insulins throughout the year. Also through the donut hole. Because in the donut hole, right, you're going to be 25% of the cost of the retail. Well, you don't have that anymore. You're going to pay $35 all the way through. Same thing here. Physicians, make sure your doctors are contracted next year. You might say, I need hearing aids. Now, my wife says that I have selective hearing.
All men do.
Only do. Thank you for that. You're right, actually. I just say all of a sudden, this next year you need hearing aids. Well, let's see if we can find you a plan that offers a better hearing aid benefit than you have on your plan this year. Or I want more dental than I have this year. Well, let's see if there's another plan that has more dental, still covers your meds and your doctors. There's 55 plans. There's a chance that one of those plans will be better for you because they change every year. There's new benefits coming on every year with these different companies. And they will change. You may have you may have physical therapy on an ongoing basis. And I'd like to be able to go, be able to be charged less to go for my PT when I go twice a week. That's what's that, 8 times a month. And if I can save $10 or $15 every time I go, it might be worth me changing my plan. Okay, well, let's take a look at that. As you can see, it gets very, very complicated. And then there are certain benefits for people with chronic conditions. Some of the plans have what we call a give back. Joe Namath has been telling people for the last couple of years that, hey, we'll give you pay for your Part B premium. Well, not all plans do that, but there are some that do it. They will pay for part of your Part B premium. It might be $25 a month, it might be $50 a month. Some plans don't offer that. So if that's important to you, we can reduce the cost of your Part B premium from Social Security. Flex debit card you can use for dental, hearing, and vision. You can go to get your glasses, and you have a $200 allowance towards frames and glasses. But it costs you $300. Well, if you have a flex card on your plan and it offers that, then you can use that flex card to pay for that difference. You can use it for a lot of times for other types of services also. Every plan is a little bit different. Over the counter, just about all plans now are offering no cost over the counter benefits. It might be $25 a quarter, could be $50 a quarter, could be $100 a quarter. They send you a catalog. It's a wide variety of products, from toothbrushes to toothpaste, supplements, vitamins, all kinds of incontinence products, all kinds of different items. Every plan has a different catalog. They'll send you the catalog. You can order it online. You can call them directly and say, here, this is what I want for this quarter. They mail it to you, no cost. We have it on our plan. My wife takes care of that. Every quarter, she goes in. She ordered ice packs, you know, when you got a headache or whatever. You got 4 of them, give them to all the kids. You know, we have one, that's all we need. So Band-Aids, all that kind of stuff you can get. It's a nice little benefit. Monthly healthy food card. So you can use that to buy groceries. Some of them you're able to pay for your utilities. Every plan is going to be a little bit different. I need to know what's important. Rewards and incentives for completing preventive health screenings and wellness activities. Plans will actually pay you for different services that you do. Then there's a list of what those are. And you can get a free fitness membership to your favorite health club. If it fits into your plan that has your medication with adoption covered. You need to determine that. So what is the process to determine which Medicare plan offers the benefits most important to you for the upcoming year? You need to list your physicians, including dentists and their clinic locations. I'll give you an example. I had a client that wanted to go to, she had cancer and she wanted to go to Seattle Cancer Care Alliance, and her physician practiced there and also practiced in her own clinic. But Seattle Cancer Care Alliance was not in that, but the physician was. So locations is very important also, just to make sure that they are contracted with the plan. If Seattle Cancer Care Alliance is important to you, you don't have, I had this happen where I don't have cancer, but my mom went there and they treat her so well. I want to make sure I can go there. Okay, let's make sure it's in the network of your plan. So if you ever need to go, you can. It's like the medication, right? You're not taking this medication, but your physician says, we may want to give you this prescription next year. We need to know that. And then with medications, dosages, how many times a day, capsule, tablet, it'll make a big difference in the cost. I have people just say, well, I take this medication and it's 25 milligrams. Well, is it a capsule or tablet? It's important because one may not be covered, the other one will, or the cost can be different. So you can see it gets very complicated. Now you can go to Medicare.gov, and I tell people, you don't need to use an agent to enroll into a Medicare plan. You can do that on your own if you want. And some people do. You can go to Medicare.gov, put in your medications. It'll tell you what plans are available and your cost of your medications. The only thing they're not going to tell you is whether your physicians are contracted with that plan. You have to do that on your own. Now, if some people want to do that, and that's absolutely fine. I welcome that. And when people do what they do and feel confident, they feel confident in it, fine. However, there is no cost for an agent to do that for you and be available year round. And then what you would do is obviously you find out what your medications are, and then you can call your physician's office and ask them if they accept that specific plan. Don't call and say, do you cover X company? Oh yeah. Well, you want to make sure it's that X company Medicare Advantage plan, this number, because some physicians will accept a group plan from X company, but not Medicare Advantage plans from X company. So you have to be very specific when you're doing your research. That's why people will make mistakes. That's why I said, you have an agent, use your agent, have them do it for you. And when I send my reports to people, I don't say, hey, you're good to go for next year. I show them what their costs of their medications are going to be next year. I show them that I snip and send it that all their doctors are contracted with their plan for next year. I don't want any confusion. And when I send a list of medications, I tell them, please confirm that I've got the correct medications, dosages, etc. It's on for you, because I've had people send me a list of medications, did a report, send it to them, and they go to the pharmacy and when their medications are covered. We look and see, and said, you never said this, so I forgot to give you that medication. That's why you need to review, put a lot of work into these reviews. So I expect my clients to at least take a look at it, confirm the information is correct, then you're good to go for next year. All right. You can also call that Medicare plan specifically and ask them if that doctor's in the network. Always remember that anytime you call, everything is recorded. Always write down the time, date, and the person you speak with when you're calling your plan. Why? Because if they give you the wrong information, now you've got some recourse. You can say, wait a second, I talked to Bob on October the 12th and at about 12:45, and this is what I was told. They can pull up that recording and find out. And then at least you have some recourse. You have to rectify it. If you say, well, I called Bob about 3 weeks ago and, I don't remember what day it was, good luck. Most likely you're not going to be able to find them. That recording. Okay, and just make a list of benefits that are important to you. Like I said, once we determine what your doctors and medication, what plan are covered by them, then we say, okay, what else is important to you? Dental, vision, hearing, etc. Then what we normally do is we'll review the top 3 plans that are available to you and compare costs, benefits. And that's for you to take a look at and ask questions, a little detail, but you'll say, well, wait a second, why does this plan have this benefit, but this one does not? I don't know, they're just not offered this year. That benefit's important to you. That's why we want to take a look at this plan. Okay, and then you can also, if you're going to do it on your own, just call the plan up and enroll on your own right over the phone. The enroll prescription drug plans, we talked about this also. Now, one thing, this is important. You're on a Medicare Advantage plan. And during annual enrollment, October 15th to December the 7th, you don't make a plan change, you didn't do it. January rolls around, go to the pharmacy, and your medication isn't covered. Okay. But I do have open enrollment from January 1st to March 31st. I have one more opportunity to make a plan change. You have a supplement plan / Medigap plan. Talk about that, right? And then the alphabets, Plan G and Plan N and Plan L, all those. You have a standalone prescription drug plan. You cannot make a plan change for your prescription drug plan in open enrollment January through end of March. You have to do it during annual enrollment October 15th to December the 7th. So if you have a supplement plan, and I tell my supplement clients, you got to get me your prescription drugs now. We have to look at them now because after December 7th, you're locked in for the next year, no matter what.
Are the drug companies, when do they have to make that call? Do they have to make it by December 7th also for the following year?
You mean the list of drugs?
Yep.
Those will be available October 1st.
And they have to stay. They can't change that in that time frame.
There are situations, very rare, where they can pull a medication off their list but there has to be a reason for it. The FDA said this is not safe anymore. They just can't remove it and say, well, this is costing us too much. Once they set their formulas, they're set, unless there's a real good reason. And I very seldom happens, but it can. Neil, have you ever run into her about that? So that's important to know. Good question. Okay, we talked a little bit about this. If you have Medicare and Medicaid, you can be eligible for a dual special needs plan called DSNPs. What are they? Well, when I have some clients that they have very low income, they're on disability, just depends on the situation, they might be able to enroll in a plan that can cost them nothing for their medical services. They go to a hospital, it's all taken care of. Cost of their medications are extremely low, sometimes zero. So we really take care of the people in our communities that need it badly. And that's a real important thing to know about Medicare. But for those who on DSNP plans, I have several of them, many, more nowadays than in the past. People income, everything is changing real quick on us. And some people are becoming eligible. Yes,
Is their enrollment period still the same as the other?
no, good question. They can enroll anytime during the year when they become eligible for it.
Okay.
Yes, and then on top of that, they can make a plan change each of the first 3 quarters of the year. Let's say in April, they say, well, I'm going to move to a different plan. They can do that. And it takes effect the next quarter. So they have the ability to do that. And what will happen sometimes is, these plans will have a lot of dental coverage in them. And what will happen is a lot of people will get some dental done in this plan and then they'll move to a different plan to get more dental done because it kicks back in. So, yeah.
Is that it's detailed information on the website regarding that?
What's that?
That they're able to change their recorder.
Right.
Okay.
You can go to Medicare.gov. Yeah, and go to DSNP and the goals, and you'll find it in there as well. You're welcome. Okay, this is kind of extra stuff. So that is the end of the presentation. Do we have more? You can clap if you like. Any questions? I had some great questions today. Thank you for that. And I'm available. If anybody has any questions afterwards, or you can call me. You have my business card there. You can call me anytime, send me an email, whatever it is. But if you plan to go on to a Medicare plan, think about it 3 months before you need to go on. That's when you start to get the wheels going. You get that done. It takes 4 to 6 weeks to get approved for your Medicare Part B. And Part A will automatically be in the system, but Part B is going to take a while. So you only got 3 months. So if you do it early, you're going to be, it might take half of your 3 months. Half of those 3 months might be waiting for your Part B to be approved. So you don't want to wait till the last month to try to apply for Part B. You may end up having not having coverage for that 1 month because you delayed what you should be doing. So any question on that, all you need to do is ask. That's the thing. And yeah, so if you're, and it happens sometimes where people retire quickly. I got laid off. Okay, well, you can have COBRA many times on your plan, but that's going to be very expensive. Everybody knows how COBRA works. Yeah, so let's say your employer has medical insurance for the company for all the employees, and you're paying $250 a month, and the company's paying $750 a month. So it's $1,000 premium that the company that is being paid into for the insurance company. Well, if you go on to COBRA, you can have COBRA up to 18 months, but you're going to pay that $1,000. No longer the $250, you're going to pay that full premium. So, however, you do have that ability, and I just had this done with a client. They waited too long to enroll for the Part B, and was going to extend past the day they wanted to enroll. So they opted for that period for 1 month to be able to make sure they had coverage. So you do have that option. But it's always good to just ask questions, even if it's a little bit late. How do I do this? What do I do, etc. But what will happen also many times is Social Security realizes that, especially now after COVID, it takes them longer to do things. Their staffing is shorter, a lot of work to be done. So if you apply for your Part B and let's say November, this is November, you apply and your Part B isn't approved until November 15th. Normally, they will retro that back to November 1st. So you have coverage on Medicare. However, you can't enroll into a Medicare plan until you have A and B in the system. But if something catastrophic happens, you have to go to the hospital, you will have Medicare coverage through your red, white, and blue card. But we don't want to get to that point. I don't like my clients get to the point where there's any of these unknowns about whether I'm going to have coverage or not if something happens. Make sure you do it 3 months before you're going to need coverage. That's when you want to call your agent and get things rolling. And what will happen, a lot of times people will say, for example, you might have on your sheet there, turning 65 in June. Okay, well, what I will do, and if you give me your information, what I'm going to do on March 1st, I'm going to send you an email. Say, I'm to enroll in Part B. If you want to enroll in Medicare, you're going to stay with employer coverage, you don't need to. So I do try to do as much as I can, help people understand it.
I don't understand. You just said that you don't need to apply for Medicare if you're going to stay on insurance.
If you, employer coverage, you mean?
I'm turning 65 next July.
Okay,
My husband is still working. He doesn't turn 65 until January of 25.
okay.
But I will still be covered under his benefits, but I thought I still had this.
You don't need to enroll in Part B.
Not in Part B. Okay.
Part B, you'll automatically be enrolled in Part A. It's an entitlement. You should get a red, white, and blue card in the mail. Let's go back here real quick.
So the 3 months prior is just for Part B?
Yes. So you,
Oh,
yeah,
How about the drug penalty? When does that kick in, the drug coverage penalty?
it's when if you're eligible for Medicare and you don't have prescription drug coverage.
So as long as you have the private insurance, you're good.
If you have, yes, it's called creditable insurance coverage. Now, just to make things a little more complicated, if your husband is working in a company that has 20 employees or less, you have to enroll in Part B. If it's 20 and more, you do not. I don't know what.
So it gets even more complicated. He's going to retire before he turns 65.
Probably gonna want to, you're probably gonna want to enroll into a Medicare plan at that point. And he may have to go on to COVID. Yeah. Just give me a call. You're gonna forget this.
I think we're going to need to do that.
Yeah, just call and ask the question and say, hey, look, my husband, 5 months from now, he's gonna be, this is what's, it looks like it's gonna happen. What do we do? And you can put it on your calendar. This is the timeline of what you have to do.
Great.
Yeah, great question.
I might add, and I'm seeing people come in who I consult Medicare, carrying their Medicare card with them. The strong advice is do not carry your Medicare card with you.
Yeah.
Your healthcare provider should have your Medicare number. But you should not carry your social security card, you should not carry your Medicare card.
Yeah.
Because if you lose the cards, someone finds that they can commit all kinds of fraud with.
Well, and it used to be this number right here. This is about 4 years ago. What was that? No. Can you believe that? With a number at the end, a letter at the end, like A or whatever. And so people lose their card. Well, that's ridiculous. So finally, the government, took a while to figure this out. Fraud and all that. So now they put this random number. Doesn't mean if you're right. Doesn't mean that people can't use it to worry about it. But the reason I brought this up is in your situation, you're going to turn in July. You should be getting a Medicare card that has this Part A on it with your birthday month. No cost to it. Now, when you go to enroll, when your husband retires, you're just applying for Part B.
Okay. That clears things up. Thank you.
Okay.
But then also your supplement plan or your advance one.
What was there?
Before, when her husband retires. And you're qualified for Medicare, you already have your Part A. And obviously you want to apply for Part B,
Right,
but then you also want to apply for a Medicare Part D or an Advantage plan.
And that's when you want to go with the Medicare Advantage plan or a supplement plan at that point.
okay,
Yeah, I think that's because that's when you're first becoming eligible for Medicare. Not when you turn 65 because you've got creditable coverage. If you don't have creditable coverage or any kind of insurance, and you're turning 65, that's when you become first eligible. There are different eligibility criteria. And that's where mistakes are made, is understanding. And in your situation, it would have been just like that because you have, sorry for that, your husband is retired before he's turning 65. So now he's got that little bit of an issue, but Cobra probably will, what he'll want to be on for a couple of months.
it's nice to know there's people out there like you that can guide us, that have the experience, because this is both a lot.
It is.
And I want to advertise another service besides what Bill does, and he does a great job. I don't want to minimize his service. You can also call SHIBA, State Health-Wide
Insurance. Broker,
Insurance benefits advisor.
So these are volunteers, like myself, and Ray is working on it, and there are a lot of volunteers here in Pierce County administered at the county level by Sound Outreach, but statewide through the State Insurance Commissioner's office. And as Ray can tell you, you have to go, these volunteers, when they first start, they have to go through extensive training, and it's gotten even more detailed since I went through the training many years ago. So, yeah, also that option.
Yeah, and it's a great, SHIBA is a great organization, volunteer organization that does wonderful work. They can't tell you, they can't talk about benefit plans on different plans. They can't talk about the different insurance companies and different benefits within them, but they can kind of give you an overview of what you can do in certain circumstances with Medicare enrolling and that type of
So, you know, and as an example, what Bill just said about contacting his client every fall and lay out all the possibilities. Obviously, SHIBA volunteer does not do that. It's simply, it's not the time.
Yeah. Okay. Anything else? Yes,
Thank you.
Ray, you're welcome. I remember you from last year.
I'm good. I'm glad you do.
I want to
I
talk to you.
remember you, and I said I better take the class. Why not? You told me.
I want to talk to you afterwards. I have a question for you. I want to ask you personally.
I actually have to do one question. So I'm like looking at my parents and look at my mom's Medicare card, and in both of it, it's clear to me she has an Advantage plan. How do I figure out what benefits they have? Where would I go to find out?
Are they here locally?
Yeah, King County.
Okay, yeah, email me.
Okay.
And, well, they have a card.
Yep.
Okay, so you tell me what plan they're on. I'll send you a summary of benefits. That'll show you all their benefits and costs on their plan for next year.
Because they pay pretty much nothing. And so I'm trying to figure out how that is.
Yeah, they're on a zero. There's a lot of zero monthly premium plans out there. You know, personally, I'm on one. My wife is on one.
It's paid
Go to the
off for
doctor.
them, I'll tell you that much.
What's that?
It's paid off for them.
Yeah, I go to the doctor once a year, take a couple of generics. Cost me $15 to see my doctor once a year, and my medications are free. I do them by because they're generics, and I get a mail order, and they send them every 90 days. Why pay a premium if you're not? Now, I can mention there are plans that have premiums on them. Why would you want to pay a premium if you can get a zero plan? Well, maybe because it has more dental in the plan, or that your co-pays are a little bit less because you're paying a premium. I pay $15. If I pay maybe a plan that had a $50 premium, I pay zero when I go see my doctor. If I go once a year, so why do I want to pay the premium? The type of things. So,
Right, Bill, I locally recently in this community, we're seeing what they call federally funded community health care clinics. FCHC. And there's one up by the Shell gas station, up the road here, and one in town here now, I think Bill Rose is old thing, and there's another one down, I think, right by the library, I think.
No, he's not that Brett Price, he's not.
Okay, well, anyway, but we had a health fair here this last Monday on the holiday. And one of the representatives was talking about that these federally funded community health care clinics, when they take the federal funding, they are obligated to take the doors open, and there's no limits as far as your background financial picture. You don't have to meet a certain profile to be able to walk through the door. And it just struck me as being, I heard those words, and then I walked over to Dr. Rose. And Dr. Rose was right at the table in the same room. And I said, what do you think about this? He said, well, we don't take Kaiser Permanente advantage plans at our clinic, and we're a federally funded community healthcare clinic. So I just wondering, if you heard, is there a gut flying about this now, or is this a bone of contention within the?
Yeah, I don't know. I wonder if community healthcare is one of, they have, matter of fact, they have 5 clinics in Tacoma.
Yeah, there's 27 of them.
Yeah.
Yeah.
And matter of fact, I did a lot of seminars there they have, they call them navigators.
Yeah.
And I educate them on this. And, but I'm not sure about the federally funded, how that all works.
I do, if I may, I do know that one of the reasons they're federally funded is they get a higher payback from Medicaid programs.
That's true too.
So that's part of it. So I don't know if that is what comes into conflict with it. Like,
Well, and such as Kaiser, they have pulled out of certain places
Yeah.
because the other clinic doesn't accept all of Kaiser anymore either because Kaiser pulled out. Of a lot of the places, they're tightening up where they're allowing their clients to go.
And they're an HMO.
Yeah.
So they have a tight knit, you know, Kaiser, a lot of Kaiser facilities, everything's under one roof, which is kind of nice. Where in others, you can go here and there and different services, it's an advantage. But not all physicians contract with all. Matter of fact, I was just I saw Chris Price just an hour ago or so. There was an issue and I wanted to go in there and help her out with it. I get a lot of referrals from them. I got referrals from community healthcare, a lot of places. But not all physicians contract with all plans. And Kaiser is kind of that way now. I think, matter of fact, if I'm not mistaken, they were contracted with Franciscan, but not now. But they will allow you to go outside of their network. They will approve to see a specialist if they don't have one they feel is fit your needs. Yeah.
The reason I brought that up was it seemed like there was a broad general statement. I did a little research on my own over the weekend, look things up. And it just appeared that there's a general guideline, that there's so many if, and but, so there's the variations are great. And I thought I wonder if there's a key place that we can go to find detailed accurate information.
I don't know where you can find that, other than maybe go to Community Healthcare's website.
Yes, exactly right. They talk about priorities and the way that they're performed and all that. Yeah, I just didn't find it. So that's why I asked.
Yeah, it's a good question. And these plans are evolving, all the healthcare is evolving, constantly. I do know that community healthcare does offer a lot of help with costs. People can't afford it, and I know even multi-care does, Franciscan does also, but I think community healthcare, they'll even help out with the cost of medications through their pharmacy. And I have other people call me and say, my buddy said that he's your client and I want to enroll in his plan. He loves his plan. He just, he just raves about it. You get all these benefits and whatnot. So I want to enroll in that plan. I said, no, that's not the way I do it. What do you mean? I want to enroll in that plan. I said, okay, give me your information first, and then we'll talk about it. So I do my research and I call him up and I said, Well, you can enroll on your buddy's plan if you want, but you can't see your cardiologist. Whoa, hold on a second, I gotta see my cardiologist, I've had him for 15 years. Okay, well, that's why we do a plan review. You can't just, because your buddy has a plan that works for him. Obviously, he doesn't use your cardiologist, he has one at all, he's not using yours because you would know about it. You wouldn't have any coverage. Anything else? I won't keep anybody after school, I've been real good, no problem. Ray was a little bit of a problem, yeah, but he's always a problem, so, but we can't help that, it's just his nature. Okay, well, thanks for coming.
Thank you.
Thank you, Bill.